I'm a nurse who broke protocol to save patients. Now my skin is cracking open. Working at the hospital most days has its ups and downs, especially with the budget cuts we've endured these past months. It's gotten harder to understand what the administrators expect of us when we're stretched so thin. Honestly, it's a struggle for patients to even see a doctor these days. It's difficult to reconcile that a system meant to care for people so often just guesses. So often it shrugs. What I've learned is this: the only thing that saves a patient anymore is a doctor bending the rules, or one of us nurses actually putting in some work. It started small, these unconventional methods. A burn victim came in, and we had no available rooms, no proper anesthetics. Just me and 3 other nurses scrambling for a solution. Then I thought of something. Nearly expired experimental medications for pain relief for chemotherapy, stockpiled for another department. The others hesitated. It was a risk, but it worked. The patient recovered. Slowly they came to see things my way. Now, our unit reports a 5% better recovery rate than the others. But we don't talk about how. Not to patients, not to doctors, not even to new nurses until they've been broken in properly. Other cases had improvised solutions, but then came the ones that didn't. The ones where we had to decide fast who got pushed through and who wouldn't last the wait. After a while, the solutions got creative. The second time it was a child. Leukemia, with the oncology unit backed up for weeks. His mother begged, her voice fraying at the edges. The boy's veins stood out like ropes beneath his papery skin, his breath wet and labored. I'd seen the signs before. He wouldn't survive the delay, so I took one of the spare chemo vials. It was expired technically, but what wasn't these days? I diluted it. Half dose. Just enough to stabilize him until real treatment could begin. He seized within minutes. Not the slow fading kind, violent. Back arched like a bowstring, fingers clawing at the sheets. We pinned him down, shoved a bite guard between his teeth. His mother screamed. The other nurses looked at me like I'd handed him poison. Maybe I had, but by morning his counts improved. The oncologist called it an unexpected remission. The mother cried in relief. Nobody asked questions. It was after the kid that I started paying closer attention to the chemo vials. The drug name was Unfamiliar Startup's logo, a snake eating itself. When I asked admin about the stash, they just shrugged. Probably a trial batch. Don't overthink it.